Hello, dear viewers. Today we are going to talk about a very important health topic, colon cancer and its earliest symptoms. In the past, colon cancer was thought to be a disease that only affected older people. However, in recent years, this type of cancer has been increasingly seen in younger individuals, even in their 20s and 30s. So, why is this happening? There are several key reasons. Unhealthy eating habits, obesity, a sedentary lifestyle, frequent consumption of processed foods, genetic factors, and environmental influences are some of the risk factors that contribute to the early onset of this disease. But don't worry, today we will share more information on this topic and perhaps a few important tips that could even save your life. The symptoms of colon cancer can often go unnoticed or be confused with other conditions, delaying the diagnosis and treatment. That's why it's so important to watch this video until the end and don't forget to share it. Being informed is one of the most important steps you can take for yourself and your loved ones. First, let's take a look at the three main early symptoms of colon cancer. The first one is blood in the stool. We all experience digestive issues from time to time, which is completely normal. However, if you notice bright red blood in your stool, you should take it seriously. This symptom is seen in about 45% of younger colon cancer patients. Of course, this doesn't always mean cancer. Sometimes simple conditions like hemorrhoids or anal fissures can also cause this kind of bleeding. But be cautious. Instead of assuming it's just hemorrhoids, take this seriously and consult a doctor. Ignoring blood in the stool can lead to the disease progressing to more advanced stages. There's no need to panic, but it's always wise to be cautious. Another important symptom is abdominal pain. We know that abdominal pain is a common complaint, especially for those who have irregular eating habits or are under stress. However, if this pain becomes persistent, especially after meals, it might indicate something more serious. Studies show that about 40% of colon cancer patients experience abdominal pain. What's crucial here is whether the pain occurs regularly and how it affects your bowel movements. If your pain is persistent and accompanied by other symptoms, don't ignore it. Abdominal pain can be related to the growth of a tumor causing a blockage in the intestines. So it's not just a simple stomach ache, but a sign of something far more serious. The third symptom is changes in bowel habits. What does that mean? Normally, if you experience constipation or diarrhea, you might think it's temporary and related to stress or dietary changes. However, if this becomes a regular issue lasting for weeks, you should definitely consult a specialist. A sudden change in your bowel habits, such as persistent diarrhea or constipation, could be linked to tumors obstructing the intestines. This is another critical warning sign. If you're alternating between diarrhea and constipation, your body may be signaling you that something is wrong. In addition to these three main symptoms, there are a few less common signs that colon cancer patients may experience. For instance, unexplained weight loss. If you've been losing weight without making any changes to your diet and this continues, there could be an underlying issue. Unexpected weight loss has been observed in 17% of colon cancer patients. Alongside this, loss of appetite is also a common symptom, often related to the tumor's effect on metabolism and appetite suppression. Constant fatigue and feeling weak is another indicator. Tumors can cause anemia, leading to persistent tiredness. So how seriously should you take these symptoms? As we mentioned, not every symptom means cancer. But if these symptoms persist over time, you should consider the risk factors. Especially if you have a family history of colon cancer, you shouldn't take these signs lightly. Remember, colon cancer can be genetic. If your parents or siblings have had this condition, you may also be at risk. Now let's talk about the good news. Early diagnosis offers a chance to completely beat colon cancer. If detected at stage 1, colon cancer can be cured almost 95% of the time. So recognizing these symptoms and consulting a specialist can save your life. However, if the diagnosis is delayed and the cancer progresses to later stages, the treatment process becomes more difficult. For example, if the cancer is caught at stage 2, the chance of recovery drops to 70%. By stage 3, this rate can fall to as low as 40%. That's why early awareness is crucial. Lastly, let's share a few tips on how you can reduce your risk of colon cancer. First, evaluate your eating habits. Make sure to include fiber-rich foods, whole grains, legumes, vegetables, and fruits in your diet. Avoid processed foods and limit your intake of red meat to once or twice a week. Regular exercise and maintaining a healthy weight are also essential because obesity is one of the leading factors that increase the risk of colon cancer. Minimize alcohol and tobacco use as well. And of course, don't forget about regular screenings. Starting at age 45, having screenings like colonoscopies to check your intestines is incredibly important for early detection. In conclusion, colon cancer can be scary, but it is a disease that can be completely treated if detected early. By taking these symptoms seriously, you can take the most important step for your health. Please take care of yourself, listen to the signals your body gives, and don't hesitate to consult a specialist if needed. Health is the greatest wealth. Take care and share this information with your loved ones to help them become more informed as well. Stay healthy